Let me ask you a question, Lou. Considering what kind of surgery he had, what kind of aftercare should he expect, or would you want him to have with the primary care physician?
So the team that Dr. Ahmed's talking about extends beyond the surgery with the primary care doctor. There has to be good coordination between the cardiologist and the primary care doctor to continue to monitor that valve. So these patients very often have serial echocardiograms to make sure the valve's functioning and staying healthy. We watch for any signs. Sometimes people can get these valves replaced a little bit too late and they may develop heart failure. They could still develop coronary heart disease as time goes on. And you want to manage their risks. You want to make sure if they have risk for coronary disease, you're maximizing. That blood pressure control becomes even more important now. And actually, a good point also is even before the valve is placed, like I told you, very often we can pick this up by exam or by echocardiogram. When I was in medical school, we were taught, you pretty much don't replace the valve until they're symptomatic, right? It's giving my age away. We don't think that way anymore. These patients have to be very carefully monitored depending on the degree of heart valve disease they have. And they may need echocardiograms every couple of years, sometimes every year, because you're watching not only for symptoms, but watching the way the heart's pumping, how strong it's pumping, because very often that's an indication that gets them to the surgeon or someone like Dr. Ahmed sooner than later. We don't really want to wait until they get very symptomatic, because now we have this wonderful technology where they don't have to have damage done to their heart from the valvular disease. So that close follow-up is important.